What if one tiny injection could change the way your brain, stomach, and metabolism respond to food? That's essentially what GLP-1 weight loss medications are designed to do. Drugs such as semaglutide and tirzepatide have become some of the most talked about treatments for obesity and weight management. But what actually happens inside your body after you take them? From your first dose to changes in hunger, digestion, blood sugar, and body weight, here's what's happening behind the scenes. It starts with your brain. GLP-1 is a hormone your body naturally produces after you eat. One of its jobs is to help regulate appetite and blood sugar. GLP-1-based medications mimic or activate this pathway. As the medication takes effect, signals involved in hunger and fullness can change. You may feel satisfied after eating less food. And for some people, cravings and the constant feeling of wanting to eat may become easier to manage. This is one reason these medications can feel so different from traditional dieting. Instead of relying entirely on willpower, the medication changes biological signals involved in appetite. Next comes your stomach. GLP-1 medications can slow the movement of food from your stomach into your small intestine. That means food can stay in your stomach longer. The result? You may feel full for a longer period of time. A meal that once felt like it wasn't enough may suddenly feel surprisingly filling. But this effect can also explain some of the most common side effects. Nausea, bloating, vomiting, diarrhea, or constipation can occur, especially when starting treatment or increasing the dose. For many people, these effects become easier to tolerate over time, but not everyone responds the same way. Now, let's look at your blood sugar. GLP-1 medications can help the body release insulin when blood glucose levels are elevated. They can also reduce signals that would otherwise raise blood glucose. This can improve blood sugar control, particularly in people with type 2 diabetes. And because appetite may decrease at the same time, many people naturally consume fewer calories. That creates an important chain reaction. Less hunger, less food intake, better blood sugar control, and over time, potentially significant weight loss. But there's something important to understand. The medication doesn't simply melt fat. Your body still needs an energy deficit to lose stored body fat. The medication mainly helps make that process easier by changing appetite and other metabolic signals. As body weight decreases, your body begins using stored energy, including stored fat. But weight loss isn't made of fat alone. Some lean tissue, including muscle, can also be lost during significant weight loss. That's why nutrition and physical activity still matter. Getting enough protein, eating a nutrient-dense diet, and doing resistance exercise can help support muscle during weight loss. This is especially important because the goal isn't simply to make the number on the scale smaller. The goal is healthier body composition and better overall health. So what happens after weeks and months? For some people, appetite stays lower and weight gradually decreases. Blood sugar may improve. Some weight-related health risks may also improve as excess weight comes down. But results vary from person to person. These medications also aren't appropriate for everyone. They can have serious risks and contraindications, and some people may experience significant gastrointestinal side effects or other complications. That's why these drugs should be used under the guidance of a qualified healthcare professional, not simply because they are trending online. So, what really happens when you take a GLP-1 weight loss drug? Your appetite signals can change, your stomach may empty more slowly, your blood sugar regulation can improve. You may eat less without feeling as hungry, and over time, your body may use more of its stored energy, leading to weight loss. But GLP-1 medications aren't magic. They're powerful medical treatments that work best when the benefits, risks, nutrition, activity, and long-term plan are considered together. And the most important question isn't just, how much weight can I lose? It's, how can I become healthier and stay that way?